Japan has a rapidly growing elderly population. Currently, almost 30% are over the age of 65, which is the highest proportion of any nation. With continued advances in life expectancy and a decreasing birth rate, this proportion is expected to grow.
Chronic diseases like hypertension, peptic ulcer disease, and dementia are prevalent in the Japanese elderly population, often caused by lifestyle choices such as smoking and drinking. Co-occurrence of these diseases is very common. Families are often responsible for caring for their elderly. However, changing demographics, cultural shifts, and an increased incidence of chronic disease have made it harder for this system to be maintained.
Japan is also tackling issues regarding social isolation, which is the lack of contact or relationships with friends, family, or society at large. 15% of elderly men living alone have less than one conversation in 2 weeks. This drastic isolation can lead to suicide, which has the highest rates in Japan. Elderly have higher rates of suicide because they feel that their age is a burden on society. Poor and disabled elderly face the most mental health issues, but often refuse help because of the attached stigma.
The Japanese public health system is highly decentralized, with responsibilities being split among central and local levels, leading to fragmentation and diffuse policies. Additionally, there is no continuity of care since people do not visit a general practitioner.
As elderly populations increase, social isolation has become a major concern. The Japanese government has developed multiple programs in order to increase opportunities for socialization of the elderly. A study done in Japan found that there are over 100,000 clubs with 5.9 million elderly adult members. In Omuta, there is a service organization that provides events such as welfare cafes, welfare movies, and Olympics to combat elderly social isolation. Omuta City is a former coal mining center with one of the largest elderly populations in Japan. Of the 120,000 inhabitants, over 40,000 are over the age of 65. Omuta offers several acute hospitals and long-term care facilities, along with public health centers that offer free care. The Omuta government has also developed community-based programs for elderly people with dementia, due to the disease's prevalence in the elderly community.
Our solution is as follows. Elderly people will be required to obtain annual checkups at Omuta public health centers in order to maintain their driver's license and eligibility for government-sponsored community activities. In turn, they will receive a coupon book that offers discounts for wellness activities. Along with these medical checkups, student volunteers will visit elderly people monthly as part of an organization called Hand in Hand. We will organize all of this information about scheduling and checkups within a database.
While our proposal requires health checkups at public health centers, those who would prefer to get their own checkup at a hospital of their choice using long-term care insurance have an opt-out option to do so. Oh look, a friend.
For youth volunteering, students will be recruited from school, workplaces, and neighborhood associations, which have high community participation rates. Volunteers will be trained by the organization on how to approach the elderly, ask specific questions regarding health, and whom to contact if they are displaying issues with mental health or in general.
Their responsibility is to go door to door and take post-checkup surveys on the elderly, and determine who has the highest need for regular visits, especially if they've exhibited signs of social isolation or have a disability.
Our objectives are to increase regular checkups for the elderly while decreasing social isolation, to mitigate the effects of chronic diseases, to involve different age groups in tackling chronic diseases and social isolation, and to begin to streamline communication between healthcare institutions.
Through this program, we expect to see an increase in the percentage of Japanese elderly having annual health checkups. This could be measured via the amount of people who participate in the program each year.
Through the implementations of these programs, we hope to see an improvement in the population health of elderly people in Omuta City, specifically those with low socioeconomic status. Qualitative and quantitative data will be collected via the completion of health surveys by physicians. These data points will be analyzed and hopefully show an improvement in the population health and a decrease in the prevalence and severity of chronic diseases.
We chose this initiative because it aligns with the goals of public health centers, which work to improve elderly health, address mental health issues, and collect health data.
We decided to push for health checkups for preventative reasons. Many Japanese elderly eventually lose their license either by family recommendation or by causing an accident due to an age-related issue. This loss of license can cause a steep decline in mental and physical health due to the loss of mobility and independence.
Thus, this solution proposes partnering with driver's license centers and the National Police Agency to require annual checkups as a condition for the elderly to keep their licenses. Additional incentives for those who do not have a license include systems like coupon booklets for various wellness activities.
We want to have student volunteers because communication between students and the elderly strengthens intergenerational ties and builds social capital, which is especially beneficial in a culture that puts a strong emphasis on community. Having student volunteers also promotes mutual support between the two groups, and students in Omuta already volunteer to aid people with dementia, so it will be relatively normal to encourage students to get further involved.
The first part of our theoretical model is to increase the number of elderly people receiving annual health checkups. This can be done through the health centers found within the community or through private facilities. Once a checkup is completed and it has been verified, they will receive a booklet filled with different community programs and incentives. Eventually, we aim to use this program in order to allow older people to maintain their driver's licenses while reducing the risk of accidents related to their age.
The second part to the theoretical model involves student volunteers, who will make rounds on the elderly registered for the program. Meetings will include surveys to determine if elders are at risk for social isolation. If they are, the elder will be put down for monthly visits by the organization. Students may also encourage socially isolated elders to take part in activities and can inform them on upcoming events.
Our funds will be spent on advertising the new checkup requirement and volunteer program, hiring a volunteer coordinator and potentially another nurse, and creating the database and coupon book. Thus, the total cost for 5 years is about $1.5 million. We can further decrease costs by acquiring donations and grants.
In Japan, many ailments are often seen as a natural part of aging. This can make it difficult to convince elders to take part in the program, as they may not see much value in it.
To counteract this, the program will run campaigns appealing to the Japanese desire to stay healthy for the good of the community. Program incentives will also provide positive reinforcements of elderly checkups initiatives.
Another potential issue is that disabilities or lack of transportation may prevent the elderly from getting their annual checkup. To tackle this issue, we will collaborate with city bus systems to arrange for transportation.
Our timeline of activities is spread over the course of 5 years. The first year will focus on the establishment of the checkup program and introducing the license requirement to the National Police Agency. We will also focus on setting up a database containing medical information of the elderly, recruiting companies that can offer discounts for the coupon book, marketing, and establishing the volunteer organization hand in hand.
For year 2, we plan to initiate the program and start gathering preliminary data. We will first hire a volunteer coordinator and begin recruiting student volunteers to train for the monthly visits. Then, we will start our checkup program as students begin visiting the elderly. As the year progresses, we will continue hosting community events that encourage elderly people to attend the checkups.
Years 3 and 4 will consist mainly of collecting and analyzing data, improving in any areas as necessary, and growing the checkup and volunteer programs for the future.
For year 5 onwards, we will move towards national integration. We will approach the government to mandate annual checkups, and we will be recruiting donors for sponsorship. We also plan to expand our program to include mental health, even developing a mental health app for students. In the long term, we hope to integrate our program into the Japanese national healthcare system, and we plan to promote mental health apps and checkups with the ultimate goal of destigmatizing mental health.
Doctors at health centers will be expected to complete a survey detailing the overall prevalence and severity of diseases among the patients that they saw that day. Over the 5-year period, we hope to see a negative correlation between the prevalence and severity of chronic diseases and participation in the annual checkup program.
Existing scales will be used to determine severity, such as blood pressure cutoffs for hypertension and the Davenport diagram for pulmonary and renal pathologies. This population data will be distributed to the Ministry of Health, Labor, and Welfare through the General Affairs Division of Omuta Health Center.
The health surveys will look similar to the Google form and will be filled out by physicians at the end of their shifts. Forms such as these have been used throughout the United States to track provider productivity, and the same system could be used.
And with that, thank you for listening. We're Terps for Health, and this is our fearless idea.